Hello, everyone. Welcome to Worldify Academia Hub. This is your trainer, Dr. Iman Hanif, and I'll be giving you some very valuable tips for your speaking module for the occupational English test. So the first thing that you have to remember is they are not looking for people who go on stage and speak like public speakers, but they expect a minimum of performance when it comes to speaking to a second person. Okay, so they expect you to connect well with the audience or the examiner, or what they call as interlocutor in the exam. So I would suggest you to follow these 3 steps. In the Greek language, they call it ethos, pathos, and logos. So what are these terms? These are 3 aspects of public speaking which you can apply in the occupational English test. Ethos stands for your character. Character as in how you connect with the examiner, your audience, and your body language, your confidence, and the kind of aura that you display in the role play. Secondly is the pathos. Pathos is your emotional state. Understanding the patient or the interlocutor in front of you is imperative as to modify your voice, your tone, and sound more appropriate when it comes to connecting emotionally with a patient. So finding out using certain questions as to what the problem of the patient is imperative to come up with the right empathetic tone. As for the third point, it is the logos. Logos stands for information. So passing on the correct information is always very important. Your content has to be relative, and you have to sound knowledgeable. A bit of data has to be transferred from you to the interlocutor or the audience that is involved in the conversation. So my friends, always remember these 3 tips: ethos, logos, and pathos. Thank you so much for listening to me. This is your trainer signing off from Worldify Academia Hub. Hello, everyone. So this is Dr. Iman from Worldify Academia Hub, and I'm a certified occupational English test trainer. So today I'll be helping you with some steps which you could follow for the occupational English test speaking module. And the first thing that you have to remember is that the exam happens very early during the daytime. So it is quite unlikely that you could miss certain things, because early morning the exams tend to go very well. As you get into the exam mode, you will be provided with a certain set of cue cards, but before that you will have to go through certain warm-up questions. There is a procedure that they follow. First, it starts with an introduction, an official introduction of the candidate to this examiner, followed by certain warm-up questions just to know you better, and also to ensure that you are ready to speak for the role play. So the warm-up questions can be something related to your personal life or ideas, like what are the various challenges a nurse is facing in today's world, or it could be have you ever won an appraisal or an award for your good work in the hospital. And it goes through many series of questions just to test your English skills, your communication as in your confidence while talking to the interviewer, and your tone of talking. So based on your comfort, they proceed with the main part of the speaking exam, that is the role play. So what exactly is a role play? The role play is a kind of a clinical scenario which you can face in your day-to-day practice. And the role play constitutes of any clinical scenario where you could be communicating with the patient. So most of the time, nurses only get a role play that is that revolves around the nurse's job. So in the first part of the role play, you will have to introduce yourself and create an impression in front of the examiner. And what exactly you have to prove throughout the exam is that you're a daily English communicator and you're very comfortable with this language. So you just start with a casual introduction, go through the warm-up questions, and take the exam with a smile, because a person who lacks confidence in English definitely will look nervous and will tend to stammer a lot. And the nervousness is shown through your body language. So all throughout the exam, maintain a calm composure, maintain your posture as a nurse, because you're already experienced. Hey, why not? So you have been there, done that. So you have to show this in the role play. So now coming to the main part, that is the role play itself, I am going to show you a sample of the role play, and I'll take you through a few steps quickly for you to understand how you can score better in this exam. Yep. So here we are. So this is a typical nurse's role play card, and you have various kinds of clinical scenario, and this is an emergency case. The patient is a 63-year-old truck driver who has arrived in emergency by an ambulance. His CT scan showed he had a stroke. He was stabilized in hospital with medication. He is due to go home today, and he is to be treated long term with warfarin 6 mg per day, and is required to have a regular blood tests. So this is the main storyline of the role play. So based on this, you have to adjust your tone, because the patient here is already a very, he's gone through so much, and you have to sound very empathetic according to his situation. So the first part of the role play for you as a nurse consists of introducing yourself quickly and asking the patient's current condition. Like, you have to check on the patient. Okay, so generally, the first few steps that you have to follow are understand the role play. Definitely, you'll have to understand the storyline, and see whether it's an inpatient or an outpatient, whether it's an emergency department or a counseling center or whatsoever. And you have to adjust your tone according to the situation, the kind of person, the age. And be it any role play, you have to connect with the patient emotionally. You have to be empathetic to his situation. So a lot of time is allotted for, listening to the patient and empathizing with the patient, understanding the patient's feelings, and your dialogues have to be in conjunction with his problems. So supposingly, if somebody is saying that, yes, I had a stroke and I feel very scared, will I have a stroke again? So the next dialogue should be, I'm really sorry, I completely understand, I can put myself in your place and think how scared or how fearful you must be right now, and you must be so petrified with the kind of treatment that you have gone through, and after all this hospital admission and thing. But please do not worry. We are here to take good care of you. You're in safe hands, and you have to guide the patient. The whole idea of the role play is to help the patient, right? So the connection comes only when you listen to the patient and you give the right kind of statement in the next instance. So over here, in this particular role play, you will have to make the patient understand why exactly he ended up in the situation. So he may not be knowing why he have a heart attack, especially being a truck driver. You should be, intelligent enough to understand that truck drivers may not know that, how to avoid a heart attack or what is a stroke. So the first question over here, as we saw, is ask the patient what they know about strokes. So it's quite understandable that the patient may not know what is a stroke, and you will have to explain, you will have to volunteer him into all that information. And following that, you have other dialogues like explain what causes the stroke. So basically, the role play revolves around educating the patient about his condition and ensuring that he knows how to avoid it again. So you can guide him into what medications he has to take, and what are the precautions he has to take to prevent, and also for the treatment of thrombosis. That's what the role play card says. We have to ensure that the patient feels safe through your words, and the patient knows that his condition is stable. We are not supposed to scare the patient with our words. We are supposed to calm the patient down and build a trust with the patient using your empathetic dialogues. So emotional intelligence plays a very big role over here. So also, depending on the age group and the profession, you should make the patient serious about the treatment, about taking the medications, and advise the patient about the preventive measures, such as losing weight or controlling his oil intake, or eating outside food, because this is related to a cardiac problem. And in the end, you can always repeat the instructions, what you say, in order to score better, because that gives clarity and a lot of transparency for the patient when you repeat your instructions quickly in the end. And then you should also say that if you have any other doubts, you can ask me, and if not, I'll see you soon next time. Please follow the instructions. And yes, thank you so much for everything. And that's how you have to elongate the role play for 5 minutes. The cue card does not give you all the clues how to talk elaborately for 5 minutes. It all depends on your intelligibility, the way you understand the patient, and how you accurately use your words, your vocabulary, and you don't use jargon, medical jargon, to layman, to the patient who does not come from a medical profession. So he may not understand the jargon that you are saying. So instead of using scientific words like cardiac issues, or you're having major aortic wall stenosis and all, you're not supposed to use these kinds of words with patients, because they will not understand, and that will make them feel a little insecure too, and they might end up ignoring your instructions. So you're supposed to talk in very simple words. You're supposed to connect with the patient emotionally, as well as guide him how to prevent this condition, coming down to their understanding, level of understanding. Okay, so that is all for today. Thank you so much for listening to me. Thank you. And please do join our classes if you want a very good score for your occupational English test. I'm signing off from Worldify Hub. Thank you.